Hi, is it alright if I come in?
Yeah.
Hi there, I'm Brian. I'm your nurse.
Hi,
I know
Brian.
that you've had surgery on your right hip, is that correct?
Yeah.
Well, I'm here I'm here right now to do an assessment on you, head to toe. Okay, is that alright?
Yeah.
Alright, so first I'd like to just ask you a few questions. Do you know where you are right now?
Yeah, Grossmont College.
Wonderful. What year is it?
2017.
And what is your full name?
Jeanette Sibilla.
Awesome. I'm going to take a quick look at your hip. Just focus on your hip real quick, because I know that's what you were here for. If that's okay, I'm going to go ahead and pull down your blanket and take a look. Alright, so initially I see the bandaged area. I can take a quick, are you having any pain there at this time, actually?
Yeah, a little bit.
Okay, well on a scale of 0 to 10, how much pain are you in?
A 2.
A 2? Okay, what is your tolerable pain level?
I told him 5.
Okay, so you're doing pretty well with pain at the moment?
Yeah.
You think so? Okay.
Mhm.
So for this, did this pain that you've had, I know you've had it after surgery, was it kind of something that came on immediately after surgery? Did it come on fast or slow, or how was the onset of it? How did it develop?
Right after surgery.
Right after surgery?
Yeah.
Okay. Is there anything that you do in bed or whatever to make it better or worse that you notice?
I kind of stay in this position.
You
right
do,
here.
and that helps
Yeah.
you kind of keep it better.
Yeah.
Whenever you move around, does it make it worse?
It does.
Okay. How would you describe the pain? What does it feel like?
Maybe like a sharp stabbing pain.
Okay. All right. And then, as far as the pain moving anywhere, does it radiate up into
No.
your belly or down your
Staying
leg?
right here, right
It's
where
right
the
there.
surgery. Yeah.
Okay. And you said on a scale of you said it's a 2 right now.
Yeah.
Right. Okay. And how long has this been going on for you? Ever since the surgery.
Since the
right?
surgery, when the anesthesia started wearing off.
Gotcha. Okay. But they've been medicating you, and it's been working pretty well.
Yes.
You haven't had any too many bad bouts of pain.
No.
Okay, good. All right, so this time I'm going to go ahead and I put on my gloves now, I guess. Let me go ahead and put on some gloves real quick. Okay, I'm going to go ahead and take a look at your wound real quick. Just peel back the bandages a little bit. I'm going to look at the wound site, looking for any signs of infection, edema, swelling, dehiscence, anything like that, anything out of the ordinary, drainage, odor. Everything looks intact, so I'm going to go ahead and place the bandage back and secure it. And I'm going to do a focus assessment on your lower extremities, looking at both at the same time to see, just comparing both sides. So I'm going to take off your socks. Okay. You can feel me touching your toes and everything?
Yeah.
Do you have any loss of sensation?
No.
Do you have any weakness?
Maybe just a little bit on my right leg.
Okay. Okay. I'm going to feel your pulses. You have good, strong pulses on both sides. Feeling the temperature as well. The extremities are warm. Looking at the color. Color looks normal. Looks like there's good perfusion going on both sides. I can check cap refill on both sides. Cap refill looks good. And I'm going to go ahead and check your strength, okay? Will you push down on my hands? Good. And pull up. Wonderful. Okay, I'm going to look up your legs a little bit too here. Looking for any signs of swelling, DVT, anything like that. Any pain as I'm touching you up here?
No.
No. No signs of DVT or anything like that. You can feel up on your thighs too. No pain or anything like that?
No.
Good. Alright. So I'll go ahead and put your socks back on real quick.
Thank you.
No problem. Cover you back up so that you stay warm. There you go. Okay. So now I'm going to focus on kind of doing a head-to-toe assessment on you. So I'm going to assess your head, kind of down to your chest, your belly, and everything all together, okay? So I'm going to take a look at your head. I'm going to look at the top of your head, look for any signs of swelling, any pain whenever I'm touching you here, any crepitus, anything strange going on that shouldn't be there. No bruising, no bleeding, no drainage from your ears or anything like that. Do you have any headaches, anything like that?
No.
Any pain in your head? Any pain in your face and your neck, anything like that? No? Okay, you haven't noticed any more swelling or anything changing at all? Okay, good. So I'm going to go ahead and feel around here, around your jaw. Bones are intact. Everything's good. Any pain in the back of your neck?
No.
No? Looking for signs of JVD, anything like that? Doesn't look like there is any. So I'm going to go ahead and take a look at your eyes. I can find where I put my pen mark. There it is. Will you look right at my nose for me? Looking for perla. Good. On this side. Good. Okay. Eyes are pearl. Will you take a look at my pen? I'm going to move it away and just kind of follow it. Good. Wonderful. Will you do me a favor? Will you lift up your eyebrows for me? Good. Will you puff out your cheeks? Good. Stick out your tongue. Smile. Looks like everything's equal on both sides, which is good. Go ahead and take a quick look inside your mouth as well. Open up your mouth for me. Doesn't look like there's any signs of bleeding or anything in there, any infection or anything. Good. Okay. So now I'm going to take a listen to your chest as well as palpate. Do you have any pain in your chest whenever I push down? Anything like that? No? No pain at all? Do you have any pain in your chest otherwise? No? Any shortness of breath?
No.
Okay, good. So I know that you're on hip precautions, but what I'll do is I'm just going to take a listen to your lungs from the front. I'm going to have you take a couple deep breath for me. Good. Okay. Okay, lungs sound clear bilaterally. And I'm going to take a listen to your heart as well. I can listen to the aortic, and then pulmonic, and then EBS, and then the tricuspid, and the apical pulse site, and it sounds good. S1 and S2 can both be heard. I'm going to take a peek at your abdomen as well. So I'm going to lift up, take a look. I don't see any signs of swelling, any bruising, anything like that. Anything out there, any discoloration. So I'll go ahead and take a listen. Have you been able to have a bowel movement yet?
No, not yet.
And it's been how many days since your surgery?
One.
Okay. Alrighty. And have you been able to pass gas at all?
A little.
Okay. Have you had bloating or any other problems there?
A little bit.
Okay, but any pain or discomfort?
No.
Okay, good. So I'm going to go ahead and take a listen. And I hear hypoactive vowel sounds. I'm taking a listen for 15 seconds in each quadrant. Good. And then finally I can palpate. Okay. I don't feel any masses or anything out of the ordinary, any distension, anything like that. So I will go ahead. I did my focus assessment on the both lower extremities for my peripheral neurovascular. I can also take a moment to teach. So you know about hip precautions. You know you can't. Have you been educated on hip precautions?
I think they told me a little bit of it.
Okay,
Like, don't
so
cross my legs.
yeah, you can't cross your legs. Not to sit up completely 90 degrees.
Okay.
Make sure that you always, especially for the first few days following the surgery, you need to make sure that you have somebody assist you, or you have an assist device to help you get out of bed, and as well as don't rotate your toes together.
Oh, okay.
So always, call for help if you need to ambulate to the restroom or to the commode or whatever.
Okay.
Okay, so we're here to help you. And I will go ahead and take a look at your upper extremities.
Okay.
Both sides, I'm going to feel both pulses, both sides pulses, strong and regular, which is good. I'll go ahead and have you just squeeze my fingers for me real quick too while you're here. And I'm going to be looking kind of up and down both sides, looking for any discoloration, edema, feeling the temperature. The temperature feels good on both sides, nice and warm. I can go ahead and test for plantar flexion and arm drop. Go ahead and close your eyes for me, and I'm just going to have you hold them right there. Good, wonderful. Thank you so much. It looks like your arms are good. Cap refill, I'll go ahead and check cap refill on both sides. And like I said, I don't see any swelling or anything out of the ordinary. Do you have good sensation? Can you feel me touching you?
Yeah.
Okay, and do you have any tingling or weakness or any loss of sensation like that?
No.
Okay, good. Go ahead and raise your arms up for me like this. I'm going to hold on to you. I'm going to pull back on you. Go ahead and resist me as I try to do that. Okay, you ready? There we go. So it looks like you have some good strength up there. So that's good. You can go ahead and put your arms down. And I took a look at your legs. Like I said, you haven't had any pain or anything like that in your arms or in your legs. All your pain's been focused in your hip area.
Mm-hmm.
Okay. Well, we'll check your orders. Is your pain still a 2 at this time? Okay. Well, if it gets worse, let us know. And you can push your call button, and we can come in and we can check the orders and make sure that you're getting your pain medication administered appropriately and on time.
Okay.
And we'll do that. Is there anything else that I can help you with before I leave the room?
No.
Okay, let me lower your bed down. Which it is. Good. And remove my gloves safely. And I'll check in on you in about an hour, okay?
Okay.